My name is Laura Johnson, and this presentation will analyze Case Study 17.2 from the Clinical Assessment Workbook. The patient highlighted in this case study is a 93-year-old widow named Olivia Joyner. Olivia is an elderly African-American woman residing in Gary, Indiana, a city near Chicago. She has been waiting for the L at the Greyhound station of a southern town for 36 hours, believing that she is in Chicago. Olivia has displayed anxiety, confusion, and possible paranoia. She has made comments such as, "The police are scaring me," or "You can't be too careful, you know, white people can be real mean," and "I have to keep my things together. People can take advantage of you when you get old." It is difficult to determine whether Olivia's statements and accompanying behaviors indicate paranoia or an accurate perception based on her experiences. The fact that she is an African American woman living in the South must be taken into consideration. With essentially no medical history or any knowledge of Olivia's normal levels of cognitive functioning, it is impossible to make a firm diagnosis at this point. It is clear that Olivia's memory and cognition are of concern. She is displaying some anxiety and possible paranoia and is likely experiencing sleep disturbances as she has been at the bus station for over 36 hours. While almost any neurocognitive disorder could fit Olivia's symptoms with the information I have at this point, the two statistically most likely diagnoses that fit Olivia's symptoms are an NCD due to Alzheimer's disease or a vascular NCD. Alzheimer's is the most common cause of NCD, responsible for about 80% of NCD cases, and its prevalence rises dramatically with age. Vascular neurocognitive disorders are the second largest cause of NCD, and the prevalence for elderly people 80 years old and above is approximately 16%. Because of her anxiety and possible paranoia, NCD due to Alzheimer's would be a likely guess. But at this point, I would diagnose Olivia with an unspecified neurocognitive disorder. After talking further with Olivia and speaking with the police officer, some new information is gathered. We learned that Olivia has been missing for at least 6 days and that she traveled by bus from Gary, Indiana to Quitman, Georgia, which would be about 13.25 hours. We also learned that Olivia does not know the year, how old she is, or even where she is. She also could not remember her son's phone number. When asked for his number, she gave a 3-digit number, revealing the degree of her confusion. At this point, my diagnosis would remain the same. This new information is still not sufficient to provide a more precise diagnosis of Olivia's condition. At this point, the most important steps to take are to contact Olivia's family and get Olivia to the nearest hospital. The best way to make a diagnosis is to speak with Olivia's son or daughter-in-law to learn more about her medical history and her cognitive abilities. Olivia also needs to be taken to the hospital to rule out any injury, receive any necessary medical treatment, and receive an evaluation to determine the cause of her poor cognitive functioning. After speaking with Olivia's daughter-in-law on the phone, we learned that Olivia has been physically and mentally healthy. She was described as sharp as a nail, and her daughter-in-law mentioned that Olivia frequently takes the bus and navigates Chicago without any problems. Based on this information provided by the daughter-in-law, I can rule out several causes of NCD, including Alzheimer's, Lewy bodies, HIV, Parkinson's, and Huntington's. This is because all of these causes would involve a gradual decline in cognitive functioning, while Olivia's symptoms came on suddenly. With this in mind, some possible diagnoses are vascular NCD, medication-induced NCD, NCD due to traumatic brain injury, or NCD due to another medical condition. Further medical testing is necessary to determine the exact cause. After taking Olivia to the hospital, an ER nurse provides the final piece of information necessary to make a diagnosis. The nurse states that Olivia has had some sort of brain bleed, possibly a stroke. She asks if Olivia was taking any hypertensive medications, and while this information is not known, Olivia did not have any medication with her in her purse. Based off of this information, I can more confidently diagnose Olivia with a probable major vascular neurocognitive disorder. The psychosocial and cultural factors that could possibly apply to this case would be uncomplicated bereavement or problem related to living alone. We know that Olivia is a widow, and it is possible that these codes could apply to her case.